am Conrad Lo. I'm a neurosurgery PA. I'm actually traveling across the country, covering level 1 trauma centers. Hopefully today I'll just kind of talk about, how AI has been affecting my job, trying to be more efficient. So I'm here with a couple of neurosurgeons who also give their inputs.
Dr. Anthony Maioriello, endovascular neurosurgeon, owner of Comprehensive Level 1 Staffing and medical revenue recovery specialist with Calighi Recovery. And here today to experience the health conference. And we'll talk about AI and then how AI is affecting staffing and also the medical revenue recovery and how AI is going to affect that also.
Hi, Erwin Lo. I'm a neurosurgeon practicing in Southeast Texas, the Houston area. Been practicing there about 22 years now. We focus primarily on interventional chronic pain management as it relates to spine, including minimally invasive spinal procedures. So it's a lot of technology now that is directly affecting delivery of patient care, starting with access, and a lot of it is involved with interacting with the different insurance companies and payers, becoming more and more difficult. So trying to facilitate that, get the patients access to our unique service lines is key, and this is where AI, I think, can be very beneficial in helping facilitate that.
Yeah, and it's here, where I'm currently working in Virginia, AI is involved more and more into the Nighthawk radiology reads where we need stat info to make clinical decisions. Also in the clinic base, we're using with Epic DAX Copilot, which is their kind of a more ambient listening type product. So, just knowing that that's already being implemented and how much time it's saving, I think that's what the real kind of aha moment is for a lot of providers. It's like people are going to be more efficient in getting their notes done, getting their work done. And I was telling Sal, I said, the whole point of this is you want to go home, right? Who doesn't want to go home?
At the end of the day.
So if
or in the
there's
right.
technology that can kind of help us get home, hey, that's, I think, where we're heading. Increased productivity, but maybe not as much man hours, right?
Oh,
we get burnt out. We're humans too, right? Especially me and like the Centera system. It's like, I can't believe the volume is just insane. It's probably similar to UTMB.
So have you been using it in Epic?
Yeah, DAX Copilot is the artificial intelligence that actually listens to the clinic conversation. And again, it translates real time the spoken, communication, and then it actually will print out the progress note. Now, you can't really be sarcastic because it can't really, interpret that. And you do have to check it. Yeah, right.
Yeah.
Like if you say, oh, this patient looks like 18 years old, it's going to translate it to 18 years old. Yeah.
Do you use it in a hospital for consults or just in clinic?
No, I've been using something similar. My way of efficiently doing consults is, I do use a cloud-based kind of note-taking program so that it's both in my phone and the hard computer. So I have 2 access points to update information. I'll have to show it to you later.
Yeah.
But it's just more about being efficient, So, you go from doing a consult that takes like half an hour to doing it in like 10, 15 minutes. And you have to do that in a high volume place. Level 1 trauma centers is no joke. It's like the volume is what really gets you.
I just have the whole note template and then just F2 through every field.
Yeah.
So it's a little
So
My note's probably not as detailed as the PA's note. So.
well, you want to be succinct too, right?
Yeah.
Every surgeon is like,
Yeah.
hey, just
But
get to the point.
For us,
right?
we have the PAs during the day, and they do all the H&Ps.
Yeah.
And then at night, when my notes are, GCS 3 going to OR, it's
Right.
a little different.
Yeah.
Well, at the end of the day, it's about, you're right, it's the efficiency of getting the patients in, getting a proper and an accurate diagnosis.
Right.
Right. Start that whole patient journey from the beginning as you're
Yeah.
trying to deliver that care at whatever setting you're in, whether it's in a hospital based, in the emergency room, or in the clinic.
I think early on, you remember I wasn't even in school yet, and you told me, Conrad, by the first thing you had to think about when you go into the ER is what's the discharge plan? What's the end goal? So again, that was a great advice, mainly because it organized your thought pattern of, okay, we know what the end result is, either surgery or, watch them in the ICU or, outpatient clinic. But how do you most efficiently get to that point? And I think that's what we really have to, think about when AI is being implemented, is that, how do we get to our end goal in the most efficient way, but not doing any shortcuts or, not, it still has to be checked. Like I said, there are errors with DAX Copilot, with translating, and there are things that, to be honest, computers can't do, right? Like they don't interact with humans.
It can
like
replace a
human
translator.
to human. Yeah,
Right.
definitely. Definitely. There
Well,
are aspects that it can replace and make more efficient, but I guess what we do, nobody's going to replace the
The other
kind of
challenge is
the art yet. Yeah, not yet. Yeah.
Yeah.
the other challenge is interfacing, right? What the human aspect of this, and us as providers, are the shortages that we're seeing now in healthcare
Yeah.
providers, right? Not just primary care doctors, all the way to the specialists.
Right.
So Tony, Dr. Maioriello, has a good, potential solution for that in terms of helping provide some efficient staffing opportunities, for health systems
Right.
who may have shortages in specialists, especially in delivering that care, especially in emergency room and trauma. We work in the neurosurgery space, so we deal with a lot of trauma.
Right.
And there's a huge need when you look at the lack of, or not lack of, but neurosurgeons and emergency care personnel across the country.
Thinking back to your years at UTMB, that again was a very high volume place. And, can you see anything that with technology now could have changed how you kind of handled the volume or the cases?
Make the intern's job a lot easier.
That's right.
A lot easier.
Yeah.
I mean,
Like
when we were there, we were writing notes, so which
Everything
is
was
pretty
handwritten.
hysterical,
Yeah.
So they have to do 50 notes by hand,
See,
as opposed to
I've gone,
F2.
with high volume where I've been, across the nation, I've been using my phone and being more and more paperless because, again, with the dual inputs of my phone and the hard computer, the cloud-based system that I'm using, it's like I'm translating what I'm seeing real time, and then it actually is simultaneously uploaded on the
In the Epic.
laptop. So I could finish the
Are you on
consult
haiku
note.
on the phone?
Yeah, Epic
And
haiku.
you can dictate into
You
haiku
could
and it'll
dictate
record
into
it.
haiku.
Oh, you got to show me that. That'll be
Yeah,
easier.
I'll show you. Yeah.
Yeah.
So Epic definitely has thought of that. And,
For
again,
the
it's-
staffing company, AI has the ability to help physicians be more efficient, but for the staffing company, it has the ability to eliminate all the staff
Right.
and literally run the company with one person. And
Sure.
we're kind of
amazing.
working on that. Since we're
Yeah.
a startup and we're building from the ground up, we're going to be implementing these things. I mean, the agents now are conversational, and at some point, the initial approach, the initial interaction with the physician will just be with like a screening interview will be with an AI agent, not with the recruiter.
Nice.
And it's going to take, thousands of recruiting jobs. And I think some of the bigger companies are doing this. We don't have the dollars yet to invest in that, but I think that'll become cheap pretty soon. And every company will be doing that,
But how do you separate that from spam? Like you get overwhelmed sometimes.
With the spam.
Yeah.
Well, I think you can, I think what's happening with some of the bigger staffing companies is they're shotgunning. I have a job and I'm just going to I have an orthopedic job, but I'm going to harass the ENT doctors because I'm a 24-year-old recruiter and don't know what I'm doing.
Right.
And you see that a lot. And I'm sure you get lit up with requests all the time.
Yeah,
For us, our searches are very specific. I have, for instance, we're just going to release a new need today in Iowa. We have a ortho trauma need 1 week a month. Well, we're not going to send that out to everybody. We're going to send it out to the people, A, we know, B, we can have a conversation with. We're not at the point yet where we can have AI bots do this, but it's coming. It'll be pretty soon. And for us, we intimately know that hospital. I've worked there before, so it's a much different environment, but much different conversation. And so, I think we have an easier time.
It maybe can open up doors, but you still have to rely on the human interaction.
You have to have the human
relationship, business relationship. And what's interesting is Donna Shalala. Do you know who she is? Donna Shalala. So she was the former Health and Human Services Secretary for 3 administrations. Now she was the president of University of Miami, and luckily, through Sal and Jorie, I was able to sit down for breakfast and lunch with her and have some conversations about, man, you were in a position of making decisions for millions of people, right? Healthcare. And, one thing that kind of stuck out with our conversation was that he says, Conrad, people don't realize how, decision making is between 2 humans, 2 individuals who are put in that position. And sometimes, he said Democrats and Republicans liked me, so I could easily talk to both. And everyone generally agreed with healthcare. It was always bipartisan.
Right.
But what was interesting about what she said was, there's nothing that can replace like that human interaction and eventually a handshake, right? A lot of deals are made by just shaking someone's hand and just trusting that they're going to be true to their word and they're going to fulfill whatever like deal or promise they made. So that's something that's
Zoom
interesting.
Changed a lot of meetings. But when you have a real important meeting, you show up. Yeah. And then you shake hands.
You have to shake hands.
Yeah.
In order to interact, you have
seal
to
the deal or actually get it across the finish line.
Interaction. So
you need more than a Zoom.
We're not there yet. And I don't know if we'll ever be there with AI, but I was telling my friends who are more artists or artisans, there's a baker who makes very French artisanal breads, and there's some musicians I know. I said, this is a great opportunity for the artists of the world because, when we're in this kind of fast moving pace, artificial intelligence, era, people are going to want like authenticity, and people will pay for quality of service and quality of products, right? Because look at when I go to Gibson's Italia in downtown, right? That's a great restaurant. But why do people pay so darn much? It's expensive, right?
The best Italian cook's right behind you, actually.
That's right.
Well, her sauces, bring your sauces up here. Bring your sauces.
You don't have a jar on you that we can plug to.
But if you think about it, why do we go to nice restaurants, right?
Yeah.
I don't think any of us are worried about the cost, but why do we go?
Well, it's again going back to the access and trying to get as much of you're in the age of instant information. Everyone's got a phone. Anybody can Google anything at any time. Compare whatever including your healthcare. right? Everybody Googles their doctor now
Yeah.
and says, "Oh, let me see how many stars you have on your on your Google." So. But at the end of the day, it's the patient experience with the physician is what counts. And one of the biggest challenges now is, and the general public, I think, to a large extent, is still unaware of the massive shortages that are out there in physicians. The healthcare, the health systems know that because they're responsible to try to bring in doctors, mid-level providers in there to staff these communities, right? And it's becoming a bigger and bigger challenge every year because of the shortage. At the end of the day, there has to be a human healthcare provider there delivering that care, whether it's a nurse, the physician, the technicians, right? The AI technology, I think the biggest role is to try to make that as efficient as possible, given the limitations in actual manpower, right? So the more you can automate those processes, the better you can deliver that care, to that patient population and ultimately to that individual patient coming in to the emergency room or into a clinic, right? Everything gets interconnected.
So, with watching Sal's demo for Jorie, is pretty impressive. It could process a claim in under a minute and like from start to finish. So when you look at a regular practice trying to hire 8 people to go chase after the money that's owed to them,
right?
And if they could just, engage a company like Jorie that has that whole process automated from start to finish, it's really would be a game changer. It
really starts right at the beginning and getting the pre-authorizations just to be able to deliver that care and get the insurance approval to do it. I mean, we're all jumping through hoops now. You don't see it as much in the emergency room because
they take everyone,
everybody just comes in and no one checks your wallet if you're coming in bleeding to death, right? And we've been in that situation, right? But in the clinics, if you're newly diagnosed with cancer and you're trying to get your studies done, whatever, advanced imaging, diagnostic tests, if you experience any delays in that because your physician is not pre-authorized, you don't have a referral. I mean, all of those are huge challenges now these days because without that, the patient doesn't get their care, and then it becomes a delay in diagnosis ultimately, right?
Yeah, I agree. I agree with that.
I mean, for us, with my business, it's how do we have 2 clients. We have the hospital and then the practice that we're supporting at the hospital, or just the hospital, and we're developing the service line for the hospital. And then also the patients, so we've got multiple. It's kind of like Uber, right? You have the drivers and then you also have the passengers. And so, it's a pretty big undertaking, but we're solving that emergency care desert by providing physicians to areas that can't find anyone to move there. I think what's happening, the other thing that we're seeing is hospitals don't always want to employ everybody anymore because they've been burned employing people and then not getting them to do their work. Whereas when they use one of our providers, if they show up and don't do the work, they just don't go back. So it's a much more efficient thing for the hospital. And now with the medical revenue recovery and the arbitration process, the physicians are incentivized to actually take the call. Whereas before, you would do the work and you wouldn't get paid. Now we can arbitrate those claims for the physicians and they can get paid. So I think you're going to see in the next year or so a shift into, okay, well, we can't get paid doing the work in clinic, or this is really painful. But what if we took call? And what if we didn't deal with insurance companies that were really a pain in the butt? That were either downcoding or refusing this or refusing that. We were out of network for them. And then we took care of the patient in the ER and in the hospital, still had a practice, still had a thriving practice because we're arbitrating those claims for 8 to 10 times the initial payment. And I think there's just going to be a big shift in healthcare, whether it be PCPs not taking insurance and going to a cash-based model, because like you said, it's okay to go to Gibson's Italia for a couple $100 for lunch. Well, why does your doctor's visit have to be $20 copay? Why can't your doctor visit once a year be $100 also? You know, and so I think people will start to see the value of what we do if they're paying for it a little bit, you know, and B, it'll be so much more seamless for everybody. You know, the doctor won't have to have 20 people in his office trying to chase after money.
Right.
Have one person room the patient, you know? And so I think in the next year or so, you're going to see a huge shift, both on the emergency side and then both on the PCP side.
I can see the emergency side being a challenge because, you know, historically an emergency room has been just a huge money pit, you know, for just non-reimbursable care. And I think it's just because of the nature, right? Emergency situations,
right?
Yeah,
you know, patients come in, and it's hard to be able to capture all of the different sources, you know, of revenue with that.
Now we have a mechanism for that.
Yeah,
you know, it's been around for 3 years. Just a lot of people don't know about it.
Yeah,
So.
yeah.
Well, I think what Sal's company, Jorie AI, is really kind of addressing is, you know, all of these resources and staffing shortages. You know, you can't get around the fact that they need more money, right?
Yeah,
they need to fund this
Yeah.
stuff. They need to pay for providers. So where are you going to do? You just charge the patient more? No, you could look at the other side of the ledger, which is the expense side. And that's where Jorie AI is kind of challenging that side of the ledger, right? It's a huge expense for revenue cycle management. And if you could make that efficient where you're saving systems literally millions, they could focus some of those millions into the providers, right? So if you think about it, you know, it's if we think about how this is going to play out, hopefully it diverts some money back into the provider side.
Well,
right?
at the end of the day, the health systems have to survive. You know, I mean, we as the physicians, you know, the other healthcare providers have to have places, the hospitals, the clinics, to be able to deliver that care. But, you know, none of
equipment,
those,
MRI, CTs,
all the image, everything has to be integrated. And at the end of the day, it has to all be tied into the revenue cycle, because if you're not getting paid for the services,
how do you buy this stuff?
You can't stay in business. You can't keep your doors open. And especially with, you know, the cuts in Medicare and, you know, to the physicians and the hospitals. I mean, every year it's becoming more and more difficult to provide that care to the mass of patients that are out there.
Right.
The patients don't ever go away. They're there, you know.
Yeah, right.
The providers, there are shortages every year, and it's getting worse. You know, after COVID, I think you know, there were both primary care and specialists that were not quite close to retiring, but just took that opportunity to just get out of the system, you know, after COVID. And that just increased the shortages that, you know, after that.
Well, what happened was everybody took a break because of COVID.
Right.
And then they realized, oh, wow, this is pretty nice. I don't have to work as you know, maybe I don't want to go back to work. Maybe this is pretty terrible. Or,
I think we're gonna,
or maybe I'll do this part-time. So,
Oh,
so I think we had a lot of stuff that we talked about here, and you know, definitely AI is the future, right? We have to embrace it, and how it's utilized. We touched on how it could really impact our lives as clinicians, right?
Yeah.
The AI is a good, especially if you focus in on like what Jorie's doing with the revenue cycle, just to tie all the pieces together, you know, so that the health systems and the physicians' practices can stay afloat in the environment where you're getting more and more challenges and getting reimbursement, more and more hoops that the insurance companies are having us go through.
Yeah.
Right. So,
well, I mean, Jorie has put together an automation that allows the hospital to save on hundreds of employees and thousands, millions of dollars, right, in savings.
Exactly.
Now, if we can only get them to make a hospital administrator AI bot and save, and then the hospitals could save money
you
that way
probably
too.
shouldn't say that too loudly in this venue, right?
I think we're safe.
How many CEOs are here in this thing?
Right. All right. Thanks,
We can
everyone.
continue it
Thanks.
again. That's right.